Welcome back. This is Dr. Kaan at the ACL Academy, and today I'm going to talk about icing and how much should we be icing, how often should we be icing, especially early on. It's a question that I get all the time, especially for those just coming out of surgery or about to have surgery. Before I get further into the video here, if you guys have been following along and found some value out of our page, please subscribe to it, share with a fellow ACLer that can benefit from these tips. So icing is a topic that has been talked about historically forever, really, not only after acute injuries, but also after surgeries. Everybody knows the acronym RICE, rest, ice, compression, elevation, and this has been used widely for years and years and years in the sports and orthopedic world. The evidence out there, however, doesn't necessarily show that icing helps with inflammation or swelling rather, where people have widely been used for that purpose itself. We know that icing and compression can constrict our blood vessels, right? So in turn, we think that's going to stop or slow down the blood flow to that area, which in turn will help with swelling. Now, the theory makes sense. However, when we look at the evidence, it doesn't necessarily show that. So our stance here is we don't necessarily want to use ice for swelling purposes. And the way that I educate it is use ice for purposes of pain. Right? After an injury and after surgery, you're going to be in some pain, especially after surgery. Post-operatively, you'll have pain because of not only just the injury, but more so because of what the surgery really consists of, right? They cut you open, they dig into your joint, they shave things down, they drill, they replace things. So you're going to have what we call post-operative pain. Now, your doctor is going to prescribe pain medication for you, and will tell you it's important to take that as prescribed, as we want to stay ahead of the pain, and we want to be able to help you get the knee moving as soon as possible. And if you're in a lot of pain, you're not going to want to do that. In addition to the pain medication, icing can help be an adjunct or an assist, right? When we do ice, you're going to have what we call an analgesic effect. It's going to be numbing, and it's going to help provide some relief there. So we do promote that and educate that it is important to utilize this. I don't put a certain amount on it. I don't tell you that you have to do it 3-4 times a day. I don't tell you that you have to do 20 minutes minimum. No. This can be as little as 5-10 minutes just to take the edge off. You could do it once per day. You could do it throughout the day if you'd like. It really depends on you, but do it for the reason of pain control. When we're talking about swelling, a big thing is people need to understand the first part of the body's own natural response to healing is inflammation. That is the first stage of the healing process. So our body responds with an injury or acute injury or a surgery itself, healing-wise, to send inflammation, to send more blood, to send all these fluids to that area so we can send the whole army to repair and to protect and to alleviate, to help out what's going on there. Yes, too much swelling is going to restrict motion, it's going to restrict muscle control, and probably increase some pain, right? When we have so much fluid in that area, you're going to be uncomfortable. But don't think of swelling or inflammation as necessarily a bad thing, as that is the first stage of the healing process. So it's important for people to understand that. Now, when we ice too much and we constrict too much, we may not be decreasing swelling as far as the evidence suggests, but what we are decreasing is blood flow to that area. That's not necessarily a great thing either. So we don't want to be icing around the clock in numerous amounts per day, because again, that's going to constrict the blood vessels. It's going to constrict the blood flow to that area, and we actually want to pump blood flow in and out of that area. So the body's going to send blood there. We want to be able to get it out. Now, icing is not going to help with that. What I would encourage you, as far as blood flow and getting the pump working or getting the blood flow cycling, we have to get the knee moving. We have to get the muscles around the joint contracting. The muscles act as what we call a muscle pump. They're part of the circulation system. The more we can activate the muscles, that's going to help pump blood out. So for us, the way that we explain it to people is we want you moving as soon as possible and hoping that pain levels aren't too bad the first couple of days after surgery and you can start moving. We want you contracting muscles around the knee, particularly the quad muscle, hamstring muscle, and even the calf, doing some ankle pumps. Any type of muscle contraction we get going in the lower leg, this is going to help pump blood out. The other thing that we use to help as an assist to get blood and swelling out of the leg is elevation. Compression and elevation are the two main staples that I use for inflammation control. So keeping the leg wrapped an ace bandage that you're sent home with and rewrapping it so it's compressed. Also, when you're not doing your exercises, you're resting, the leg should be elevated above the heart, and that's the whole leg from the hip to the foot. That's what's going to help with swelling control. Again, with ice, I want people to understand that it is an important tool to have and to utilize. Know that it's okay to ice your knee. Know that you're icing in purposes of an analgesic and pain control. Understand that it's not necessarily taking away swelling or inflammation, and we don't want to overload it or do too much of it because we want to promote blood flow to the area, we want to promote circulation to the area. Understanding that the body's main response to healing, the first response to healing, is inflammation. So we want nutrients sent there. We just want to be able to circulate it up and out of the leg so we can get new blood in and take old blood out. Hope that makes sense there and clarifies, especially for those that you guys are prepping for surgery or just maybe had an injury and want to know about ice control and our stance to that. If you have some questions, drop them below. This is Dr. Kaan signing off, and I will see you guys here next week.